It's a great day to be alive, guys, where you can just take a deep breath and talk about whatever you want to talk about. Hi, I'm your host, Lenoria, and today we're going to talk about dentistry. Dentistry, a beautiful smile, guys. We're talking about dentistry. And I have my very own general dentist, Dr. Tiller, with me. I'm so excited. Welcome to Rumble and Roar podcast. Thank you for being here.
Thank you very much for having me.
Yes. You know what? If you've ever watched any of my podcasts, I usually jump right into the questions, and I am, guys. However, I have a story to tell. But I'm not going to tell that until we get to a question. There's a question in here that I'm going to ask, and it's going to allow me to tell the story that I want to tell. So I don't want to tell the story now because it's going to be kind of not real long, but lengthy. And I don't want to do that to you guys right now. But so I'm going to dive right in. And Dr. Tiller, when I tell you, this is always pretty much the first question that I ask everyone. Okay, what inspired you to become a general dentist?
And well, that's a great question to ask, because I think a lot of people always wonder, hey, why would anyone want to go into dentistry? Everyone has preconceived ideas about, associating with having a toothache and having pain and things of that nature. But my story is actually one that kind of came out of an incident similar to that, in the fact that when I was younger, I actually had an accident when I was 4 years old, fell down some stairs, knocked my baby teeth out at the bottom, and I got an opportunity, because I had to have a lot of dental visits to make sure that everything else would go back, like it should. I had a dentist that I became actually friends with more than just a patient. And that particular dentist actually wind up being sort of like a mentor to me. And that's what kind of got me into the interest of actually being a dentist. But as time went on, and my interest was in science and math, and once I got to college, and that's when I realized I went to a summer program for health professionals, and got a chance to shadow, different doctors.
That was so exciting.
Yes, it was. That was the moment that really propelled me to say, okay, this is what I want to do. And that's when I actually just went head forward into going.
And just dove right in.
Yes.
And kept it going.
Yes.
Oh my goodness. Okay, what's your approach to oral hygiene, and what are the practices for good home care?
Yeah, well, the main thing is that a lot of times we find that we make it more complicated than what it is. Basically, it comes down to three things. You want to brush, you want to floss, you want to rinse. Okay. You start out with, as far as, when you're going ahead and taking care of your oral hygiene at least minimum twice a day.
Yeah.
You're going to want to keep those three things in mind as far as brushing, flossing, and rinsing. And believe it or not, it comes in a particular order. Yes.
Okay, what are the orders?
And so the order should be is that you actually floss the teeth first, okay? Then you brush, and after you brush, then you rinse, okay? So that way, the floss gets rid of basically all of the plaque that's in between the teeth that a toothbrush cannot reach.
I had to think about that because, yes, I do floss. I'm trying to see if I was doing it already.
Yes.
Maybe sometimes not, but yes, I think I have been doing that, especially if I eat a steak. Well, actually, anything that I eat, I always floss it out, and then I brush. So I've been doing good.
Yes.
Okay.
And that's basically the routine that you want to have. And as far as rinsing, that can be with anything. It could be something as simple as water, but most people usually have some type of antibacterial rinse, such as Listerine or something like that. And those are good products. And as far as any mouth rinse, I always would say is that always make sure to use one that's non-alcohol based. And the reason for that is those alcohol based ones tend to be more I guess you could say, more harsh on the tissues.
Dramatic, because
Yes.
when you do it and your mouth be burning.
Yes, and that's what that burning sensation. And a lot of us, when growing up, they had these different type of mouth rinse, especially things such as Dr. Tischer's or some of the other ones that they work well, but that stinging sensation that you feel is actually the burning sensation from the alcohol, and the alcohol really serves no purpose in it.
Wow.
So that's why now you will find that when you go to any particular pharmacy or grocery store, you go on that dental aisle for mouth rinses, they now give you an option to buy alcohol free.
Yes, that's good, because the Listerine, I don't want to just say just Listerine, but there are some
basically all of the brands, they all were alcohol based at some point, and just over time, as we find out new and better things, we realized, okay, that particular rinse can be effective without the alcohol.
So Listerine does make it without the alcohol now. Okay, good deal. Okay, how does oral microbiome impact overall health, and how can we maintain that?
Yes, what you find out is that majority of the time, all of us have bacteria that's in the mouth. Now, there's good bacteria and there's bad bacteria.
Okay.
And that biome, what we want to try to do, of course, is maximize how much good bacteria is in there and minimize how much the bad bacteria. The bad bacteria will cause two problems. One, either tooth decay, or two, either gum disease. Okay? And that's the two prevalent diseases that all of us are always trying to fight, and especially in dentistry. And so the thing is, with brushing the teeth, you're getting rid of that bad bacteria.
Okay.
And that's what's known
as mouthwash too, right?
Exactly.
Okay.
And that's what's caused, that bacteria is typically known as plaque. Okay. Plaque is soft. You can wipe it off actually with your finger. And but if its plaque stays on the teeth for any appreciable amount of time, it hardens, and that's what we know as tartar. On the teeth. And so that you cannot brush off, and then that's when a hygienist or a dentist has to remove that when you come to the office to actually get your teeth clean.
You know what? See, I don't want to be telling everything about my mouth, but I have to use my mouth as an example. So when I come get my teeth clean at your office, and she's scrubbing the inside, and she said that's usually where the tartar builds up. Mostly is down in the bottom part of the bottom teeth, down on this side, guys. So why is that? Because of the saliva, or?
Well, yes, and a lot of times
I brush down there.
Yeah, a lot of times it's very difficult. A lot of times for people to even get back there. So a lot of times I'll tell patients, especially if you have a small or narrow mouth, and to use a kid's toothbrush, to get behind those particular teeth. But more importantly, it builds up the fastest there, and because that's where you have a lot of low salivary flow, and that's behind those teeth, and then the plaque sits there, and then that's when it hardens.
Yes.
And so we're able to actually be able to remove that. That's the good part about it. So that is what is known as your bad bacteria. Your good bacteria is the bacteria that's normally in your mouth that protects you against all type of diseases or any type of thing that actually comes into your micro area.
That sounds like John Lewis. Good trouble. Good
That's right.
bacteria. What in the world is good bacteria?
Yeah, that good bacteria is safest as you have the coating on everyone's teeth.
Yes.
Actually protects the teeth against diseases. And sometimes, not to get too technical, it's called like a little pellicle that stays on the front surface of the tooth. Serves as your protection. All right, and then you also have bacteria that actually sits on the tongue and on the cheeks, and all of those things together, and help fight against different bacteria.
And they have to stay in your mouth.
They have to stay there.
Fight the bad ones.
Yes.
Okay.
Yes.
Okay. Wow, guys. I love this. I love it. Okay, what are the most effective ways to prevent common problems like tooth decay and gum disease? It's pretty much what you just said.
Yeah, basically so. You want to always start from those basics. That basics are basically trying to lower the bad bacteria count in your mouth. The lower it is, the less problems you're going to wind up having.
Yes.
With any type of tooth decay or gum disease. In dentistry, gum disease is what we call a silent killer. And the reason why we call it that is because gum disease usually doesn't hurt. When gum disease starts to hurt, that's usually when it's too late.
Oh,
and usually the patient's now at a state where they wind up having to lose the teeth. Because gum disease will not only destroy the bone that actually holds the teeth in, but it also destroys the gum tissue as well. So that's when the gum tissue starts to pull away from the teeth.
So how does this happen again?
This happens from the proliferation of that plaque, which is the bad bacteria.
Right.
That bad bacteria releases toxins, and those toxins break down the gum tissue fibers, and it breaks down the underlying bone.
Does it affect any other part of your body, gum disease?
Yes, and which leads me to maybe a question that we were going to talk about. Basically, when we talk about that plaque that's on your teeth, that's the same type of plaque that affects your cardiovascular disease patients, as far as having clogged arteries for your heart and everything. When they tell you, as far as a cardiologist tells you, okay, you have a high plaque buildup in your arteries, that same composition is in the mouth as well. They both coincide with each other. A lot of times, for whatever reason, we try to disconnect the mouth from the rest of the body, and not knowing that it's all one. What affects the mouth can affect the rest of the body, Plaque that's in the mouth will affect plaque that's building up in the arteries that can affect the heart as well.
Now, I don't understand, but I do understand. I remember when I had my knee replaced, the surgeon said that I was supposed to take, I was to medicate before I had any dental work done.
Yes.
Forever. And that's been many moons ago that I had this done. I don't medicate anymore because I've been doing very well. But why?
The reason for that is that whenever you have any type of joint replacement surgery, and it's important that you also know that bacteria that's in the mouth travels in the bloodstream.
Right. And
that plaque or bacteria, which seems harmless, can attach to the joint replacement surgery that you've had. And affect your healing. And worse, it can cause an infection in that joint replacement surgery. You're most vulnerable first 2 years after that joint replacement surgery.
So it's been many moons.
Right.
And I did it for maybe the first 5-6 years.
Yes.
And it was told that, after that, even though they wanted you to do it forever, my mother had it as well, but she didn't take any. They said she didn't have to. But with me, I did it because I was just afraid. I wanted to make sure. And I did it for maybe 6-7 years after, but I don't do it anymore. And I'm fine.
The American Heart Association and the American Orthopedic Association, they usually put out those regimens. And before, it used to be exactly what you said, which is the fact that you had to do it for life.
For life.
But now what we do is it's usually post-surgery 2 years. And of taking an antibiotic prior to any dental treatment.
Yes.
And once you're past that surgery, then you no longer have to do the pre-medication.
Good deal. Okay, what are the benefits of dental x-rays? Because soon as you hit somebody's office, if you're in dentistry, they make sure they look at stuff deep. They don't just look at you and say, oh, you got a beautiful smile, let's do this. No, it's always that machine rolling out. Let's look deep. So what are the benefits of it?
Yes, x-rays is usually like a a hot topic, as far as when you
Hot topic.
when you're coming into a dental office, and because most people, number one, if they've had X-rays before, they know sometimes it's a little uncomfortable when they take the X-rays in a dental office, and then two, most people are worried about, okay, how much radiation is it, because of course we taking X-rays of basically
But y'all
all
always
of the
put
teeth.
that thing over us,
Right. And that is the lead apron that you should always have, when that's being done. And but the most important thing that has happened with X-rays now, as far as X-ray exposure, let me just talk about that just for a moment, is that traditional X-rays and X-rays now are totally different in a dental office. You may have noticed that now, when you go to your dental office, the moment that they take the X-ray, it pops up on the screen. Okay, because that's digital X-rays. We used to have analog X-rays way back, where we had to hand dip them in the machine.
Okay, yes. Okay.
And put them in a sleeve.
I thought that was just high-tech machinery now that you have. I didn't know that. Okay.
Yes, we have now digital X-ray.
Okay.
And the significance of digital X-ray, way less radiation.
Radiation. Okay.
And so the amount of radiation you get from a digital X-ray is basically less than what you would get with your microwave at home.
Microwave, okay.
So that's why I would just want to let you know that it's extremely safe. So if anyone ever worried about that, it's extremely safe taking X-rays in a dental office. But the reason why we have them is that X-rays show us a majority and a wide variety of things. It's not only just to detect whether or not someone has a cavity or not.
Okay.
Basically, we're looking at X-rays to see if a patient has bone loss. Bone loss will let us know what the severity of their gum disease. But let's go past that. You can have some type of tumor going on, and there's no way of us knowing that without an X-ray.
I did not know that.
So it allows us to see things that normally we wouldn't see just looking in your mouth.
So the tumor would be in your mouth that you could see, or could it be anywhere on your body?
Yeah, it could be a tumor. Let's say, for instance, I've had patients where they've had oral cancer in their mouth, but that's not where it started. I had a patient who actually had breast cancer, but the breast cancer metastasized to her mouth. And so in seeing that in the mouth, once I sent her over to get like a biopsy done, and we realized that cancer that I was seeing is actually secondary to her having breast cancer. Oh
Lord, what does that look? I'm sorry, I got questions. What does that look like?
Well, usually on an X-ray, you'll see like a model, basically like a dark spot on the X-ray, and then it'll be very irregular. And then usually not all dark spots are created equal, and because there's some dark spots on the X-ray that looks like normal anatomy, but on a person who has cancer of their jaw or anything like that, well, it will look different. It'll be irregular. It doesn't look like anything that you've ever seen on a normal X-ray.
Okay.
So something is going on wrong. We just don't know what it is. And once we see something like that, that's when you'll always know that we will probably give you a referral to an oral surgeon so that you can have a biopsy done. And that biopsy is sent to a pathologist. And then from there, depending on what those results are, will let us know, is it something benign or is it something that's malignant? And then from there, that will ultimately dictate your treatment.
Oh my goodness. Okay. So these young kids, and some of them, this next question, some of these young kids, they get porcelain veneers just to have them, but some really need them. Some just get them just to have them. When are porcelain veneers a good option? When is it a good option? When should you get those?
Yeah, porcelain veneers basically is really something that can be both cosmetic or something that's actually needed,
yes.
Restoratively. Let's go with the needed part. People who need porcelain veneers are people who may have chipped teeth.
Yes.
They may have had some type of trauma, or something like that, or someone that has abnormally dark teeth, meaning that If a mother actually took tetracycline, let's say during the pregnancy.
What's that?
That's an antibiotic. Most physicians now and OBs know not to give tetracycline to mothers now. That used to be a prevalent thing.
Oh my God.
And because what it does what it's supposed to do as far as fighting infection.
Right.
But the secondary issue is that it causes darkening of the teeth, and even though the teeth have not formed. Okay, so when that child's teeth.
So wait, I'm so sorry. It's not the mother. The mother's teeth get dark, or the unborn child's teeth.
Unborn child's teeth. Yeah, not the mother.
Ladies, if you are expecting, listen up. Make sure, in case your primary physician does not know about this, your OBGYN.
Yes.
If they don't know, listen to Dr. Tillard and say, hey, wait, what is this? Because I don't want to ruin my son or daughter's teeth before they're even here.
Yes.
I did not know that.
Yes. So that's why a lot of OBGYNs now, they know not to give tetracycline. But for those who that has happened to, they have dark teeth. Their teeth are healthy. It's just that their teeth are dark.
Is it reversible?
No, it's not. It's because the staining is intrinsic, meaning inside the tooth. Yes. So there's nothing that they can do for it.
Yes.
So a person like that needs veneers. Because now that gives them a new lease on life, because we can mask that out and make the teeth as light or as dark as we need them, as wide or as short as we need them.
Yes.
And for those people also, that when we start getting toward the cosmetic end of it, those people who may not only have dark teeth, let's say for instance they have spaces in between their teeth, but they do not want to instantly go through orthodontic treatment as far as having braces
and all those long
Invisalign.
years. Yes.
Then veneers are a second option for them. And that will be a reason to have veneers as well. I personally, wouldn't want anyone getting veneers, let's say for instance that's in their adolescent years, teenage years, because they're still forming, the teeth are still forming.
Okay.
And the thing about it, we don't know specifically how your teeth really are going to appear until those later years, those later adolescent years. And then more importantly, the adolescent will benefit more from orthodontic treatment as opposed to having veneers. See, veneers, because in dentistry, what we like to try to do is do the most, at least I should say the least invasive thing first.
Gotcha.
And and that would be braces.
That's understandable.
Yeah.
Yes.
And to give the person their best smile. And then we move forward to more invasive type procedures if we need to.
Okay. Okay. The ones that want these veneers just to have I think everyone wants a perfect smile. I understand that.
Yes.
I get it. But I know that there are some young people out there that I spoke with, and they were like, I ain't worried about it. I'm gonna just get me some veneers. I'm gonna just, when I get the money, I'm just gonna get all of my teeth taken out and put veneers. What? You don't just take your teeth out if they're good teeth just to have veneers. You take them out when there's issues and things going on. Now, I do realize that, like what you just said, with the browning, yes, and with really crazy spaces that you just cannot deal with. But just to have it, just to do it, come on. I've heard some say that, but I guess to each his own, right?
Yes. Well, the thing about it, I always tell patients and everyone is that, as good and as modern as the industry has become, there's still nothing I could put in your mouth better than your own teeth. So always work with what you have.
That is exactly what I tell them when they say this. These young kids, I'm gonna just get some veneers. Okay, but it's not gonna be like your own. Yes, it is. I see such and such, and these have this and that. I was like, why are you trying to follow other people? Okay, anyway, I just had to put that in there, guys. Okay, what is your approach to dentistry, especially in relations to overall wellness?
Okay, that's a great question as well. And one of the things about overall wellness is that with the the mouth, you're going to want to, again, let's get back to that bacteria. Keep the bad bacteria count down as much as possible. Because we've already talked about how plaque affects cardiovascular disease as far as with your heart and everything. But another connection as far as, with your body is actually a high plaque count affects mothers again with having preterm early births as well. Okay? There is a connection with that. We don't know exactly the cause for it, but what we have known is that people who suffer with any type of systemic oral health issues while pregnant tend to have babies born prematurely. Okay.
Goodness, yes.
And the other thing is that, of course, with overall health, we want to try to cut down on our sugar content, but that sugar content also not only helps out with teeth, but for instance, my patients that have diabetes.
Yes.
Okay. Because diabetes, when you have that, you suffer from delayed wound healing. Okay. Well, what's the big deal with that? Delayed wound healing, that's if you cut your finger, instead of it healing in 5 days,
Yes.
it'll heal maybe in
days.
10.
Yes. Yes.
Well, that slows down the healing process and your defense in your mouth too. So people who suffer with diabetes will tend to have more tooth decay, more gum disease because of the delayed wound healing effect. So it is very important that holistically, as we take care of everything else systemically in our body, that we're actually doing the mouth
as important.
Well. Exactly.
But nobody really thinks that what you just taught us, that your mouth is just, you got to do it just like you do your body.
Yes.
You can't just say, oh, well, my teeth are clean and they're good, so I don't even really need to do as much to this.
Right.
No, you don't do enough to this, it's going to affect this.
Yes.
Right.
Yes. And then in addition to that, even high blood pressure patients as well.
So your mouth,
Yes, because even with patients who actually have high blood pressure or hypertension, and when those meds that you have to take for high blood pressure,
Right.
they affect your mouth, and it dries the mouth out, which also makes you now susceptible to tooth decay. So all of it is connected. And that is the most important thing that I can actually tell everyone, is that it actually starts with the mouth. What you're putting in it, how you're taking care of it, and everything, because it's all connected. One thing causes another, cause and effect.
I am so glad that I keep my mouth up. I do. I'm always making sure that I come to my appointments and getting the things done. And I never knew these things you're saying. Some of them I didn't know. And now that I have the knowledge, I'm definitely going to make sure I keep everything up. But I didn't know as so many things affect your mouth like that. I was always going to the dentist because from I know this has nothing to do with it. I'm gonna bring it back in a minute. I'm gonna bring it back, y'all. But I've always I tried to keep a beautiful smile, a good smile, because I'm a seasoned woman. And back in the day, dark skins, it wasn't a lot going on for us. But I do know that every time somebody looked at me, the first thing they would say, "You have a beautiful smile." So when they said that to me, I knew that that's something I could hold on to. So I always tried to keep my mouth right. And I made sure that I went to the dentist to keep this beautiful smile, because they didn't recognize and realize that I had beautiful skin too. And I got a beautiful brain and everything else is beautiful, but they didn't see it back in the day.
That's
see,
right.
I'm telling my age. No, I'm not. I'm seasoned. But so I try to keep my mouth right. So now that I have this knowledge, I'm definitely going to be up in there. But oh my gosh, I did not know all of this stuff.
Yes.
Yes. Thank you. Hey, that's power. That's power. Okay, this next one is, how do you handle patients with dental anxiety?
Let me tell you this. A lot of people, almost everyone that comes in that has dental anxiety, and she's laughing, audience, because she was one of them. But the biggest thing with dental anxiety, with patients, when they come into my office, is that it's usually stemming from some experience that they've had way in the past, usually as a child, and most a lot of
Could it
times.
be hereditary? Because my mother, maybe she put it in me, she was petrified of the dentist. They couldn't do nothing. I mean, not even clean her teeth. You had to put her to sleep. You were not going in my mother's mouth.
Yeah, and a lot of that also stems from the back. Let's go way back.
Okay.
A lot of times, especially in minority communities, when it was time for you to have a toothache, due to means of not having insurance or means of not having money, most people will wind up doing what we would call shade tree dentistry, meaning that you got a problem with your tooth. Just take it out.
Pull it out, yes.
Just pull it out.
That's what they did back in, yes.
And that was our mindset, of always having that. And we always knew, we started to equate that if I'm going to the dentist, I'm about to lose a tooth.
Yes.
When that shouldn't necessarily be the mindset.
Right.
Because for anyone, whether it be a child or an adult, losing a tooth is a big thing.
Yeah.
And that's just not a easy feat. To wrap your brain around sometimes. And so most people, when you come in with anxiety, how I handle it is to find out, okay, what's really the real issue of the anxiety? Because some people will have white coat syndrome, and they're afraid because they associate the dentist with the physician. And going with the physician, okay, what's the physician's going to do? Am I getting a shot? Look,
when he said that, guys, I tell you, the shot is that traumatized me. The word shot, I don't like shots. I don't, especially not in my mouth.
Right.
But you were so right, and it mine probably did stem back from way when I was younger, and I did have one tooth pulled in my whole life. I still have all of my teeth. They've been filled. Some of them had to be filled for a certain reason or another, but I only had one. And that one was back when I was like 14 or 15. And it probably traumatized me because it hurt. And that first shot was like, this is devastating. It should not be no pain like this in my face, in my mouth. And so from that day on, it was a mess. And my mother, she just really bad with dentists, so she didn't help at all.
Right.
But nevertheless, you were so right. It started then, and I told y'all I was going to tell you a story. I'm try not to make it long.
No, you're good. You're good.
When I tell you, when I first met Dr. Tiller, guys, I was my cousin Cece. Well, let me just go back. I had a dentist for over 20 some odd years. And I want you to understand, when I get a dentist, they're with me, a doctor, they're with me for life, unless they leave or die. And the only reason I left the other dentist office is because I was there over 20 some odd years, is because he retired. So he didn't die, thank God, but he left. So I was like, oh my gosh, I gotta find another one who is going to love me and do what I need done. I'm so scared. But long of the short, my cousin Cece said, girl, you better take your butt to Dr. Tiller. Dr. Tiller is going to take care of you, and you're going to love everything. I was like, just because I said, do you feel pain with him? How is he with his shots? I went through I was asking all kinds of questions. Make the story short. She said, listen, I ain't never steered you wrong. Go up in there, make you an appointment. Long of the short, guys, I did. When I tell you, from the front desk people, all the people, his whole team, they made me feel so good. Even though I had to take my husband with me because I'm a coward. I'm a coward when it comes to getting anything done with my teeth. I'm a lot better now because it's been years now that I've been with him. But when I first walked in there, my eyes were big as can of 50 cents. And I laid back, and after his, what do you call the people that examine me first before you? Your assistants. And then when it was time, they were so sweet and so nice. They said the right things, and they made me feel really good, but I was still tense. Of course, I was bracing myself like I was somebody holding over a cliff hanger, and I'm like this. But then he comes in, he looked at me, and he can tell that I was scared, nervous, uncomfortable, all of that. And I had just met him. Every single thing from, I'm Dr. Tiller, and it's going to be okay. I can see you're uncomfortable, but you don't have to be. And I was like, okay, keep talking. Keep talking. Keep talking. But, and then I'm looking over there at my husband, and he's every single thing you did to me, and I love this. He was like, this is what I'm doing first. This is what's going to happen. And it's not going to be as bad what you think. Whatever is in my head, you wanted me to get rid of that and give you a chance.
Yes.
I did. And I'm there. And I will be there until he's die or he retires.
Yes.
That's how I am. I do not bounce around. I have to keep the same one. Mm-hmm. But nevertheless, yes, you diffused my anxiety. Mm-hmm. I love you. And when I was with you that's why I was like, you gotta come to my podcast and tell the people, you know. And look, you can believe it or leave it. I tell you, if you don't have a dentist's office, you please consider Dr. Tiller. I'm not trying to advertise or anything. I'm telling you what I know, and you're going to have a very good experience. So if you're looking for one, but I didn't mean to go there, but I had to. I did it. So
yeah, well, thank you for that.
Yes.
You know, because the thing is, your experience is with the experience I try to make for everyone that actually comes
your whole
in
team
there.
does.
Yes.
Yes.
And the thing is, if I can reduce your anxiety in the chair, and then now it makes the appointment go by a lot better.
Yes.
And because any preconceived thoughts or ideas, I want to hear about them, and then but I can diffuse those things.
Yes.
And but more importantly for me, how I approach all my patients is the fact that when you're in my chair, basically you're my mother.
Oh.
All right.
Well, you did. Oh my gosh, you treat me so good. You did.
Yes.
So.
And and for my male patients, I have to look at you as if you was my father.
Yes.
And so I'm going to treat both of them with the utmost care, so everyone gets that type of care from me. And I'm going to do anything I can to diffuse that.
You know what? That's a good way of treating someone and looking and doing someone. Because if I am your mother, you would give me the best care.
Yes.
You would be patient and just gentle. And that's just what you did. So who told you to think like that? What made you put that in your head? This is the best way I can serve this patient, by putting in my head, this is what I would do for mama. So, because that's a good thing.
And I'm gonna be honest with you, that comes from out of basically my parents when they were, they raised us, and to say, basically, do unto others as you want them to do to you. And my thing is, I'm here to help. When someone is in my chair, and I always want to make sure that you're actually comfortable in my chair.
Okay, so what makes you excited to practice dentistry every day?
Well, one of the things that I always say is that there's many different types of specialties. There's one called orthodontist who does braces, oral surgeon who may be taking out teeth, an endodontist who may be doing root canals. I'm actually a general dentist, or sometimes they'll call a family dentist or a restorative dentist.
Okay.
The beauty about that is that every day, my day is different. Because
I'm sure
when someone is coming in my office, I never know what I'm going to be doing that day. Whether it be I'm doing fillings, maybe I might have to do a crown, maybe I might have to do a denture, maybe I might have to do implants. So every day brings along its different challenge. And then depending on the age of the patient will determine what I'm doing as well. And so the thing is, it makes for a interesting day each day, coming out, because it allows me to do something different every day. And how dentistry has changed among, all over the years, because this is actually my 31st year as a dentist.
Oh my gosh, congratulations.
Thank you.
Good.
And from that time, from when I graduated dental school till now, many procedures have changed from how I actually practice today as opposed to 31 years ago when I initially graduated. And that's the other thing that actually keeps my excitement and motivation as far as every day being in dentistry and moving forward.
Okay. Oh my. Okay. Can you overdo it if you were to use the whitener? If you're whitening your teeth, with the toothpaste, that whitening
Yes.
toothpaste, because it seems like every brand out there has the whitener. What we need to get back to just a plain cavity protection toothpaste, but most of them have the whiteners in there. Can you overdo it using that whitener stuff all the time?
Well, the reason I'm glad you asked that question, and because for most people, when you have the whitening, you see over-the-counter products as far as toothpastes as well as whitening systems, and those systems do not whiten the teeth and have the strength of the whitening material in the office.
Of course not.
Okay. All right. Because of that, what you just said, which is we don't want anyone to overdo it and damage themselves. So that's the reason why you can actually use a whitening toothpaste as your permanent toothpaste, and it doesn't do anything to you, because the amount of whitening material in there is not enough to cause you any type of harm or damage to the teeth.
So with that said, if they were to come into your office and want to get the teeth whitened, with, I don't even know what it's called. Do you have a machine or something that will make it? Is that dangerous? Or I'm sure it's not, because you wouldn't do something that's dangerous to someone. But if you use that too much, would it damage it?
In-office whitening becomes an issue if a patient is trying to get that done in less than 3-month intervals. Okay, we generally tend to not whiten someone's teeth no less than 3-month intervals, and because of the fact that it will make your teeth, your gum tissue sensitive and the teeth sensitive. And what I mean by sensitive to temperature, to hot and cold. Because you may have noticed, even sometimes when you use the products over the counter, and that is a side effect of whitening materials. It's not that it's doing anything bad to your teeth.
Right.
It's just that a side effect of it is that it makes your teeth sensitive to hot and cold.
Okay.
All right. After finishing that regimen, a lot of times that sensitivity will tend to go away. Okay. But for someone who does it chronically over time, they may have chronic sensitivity.
See, I don't like to use that kind of stuff. I have, because most of the toothpastes, like I tell you, have the whitening stuff in there. But I'm so old school. You know what I use? I use the plain, I don't want to put a name out there because I'm not trying to advertise, but the cavity protected one, and I use baking soda.
Yes, it's tried and true. A lot you may have noticed that some toothpaste on the market have baking soda in it.
Baking soda make them so pearly white. Oh my gosh! And then they make them like a piece of glass when you're done. Is it too using that all the time? Will it damage because of the salt? Let me know.
And well, the thing is, you don't want to have something that's too abrasive.
Okay.
Most people will think that the baking soda is something abrasive and it will damage the teeth. Absolutely, it won't, because think about it. We actually put it in toothpaste now.
I'm gonna tell you, because if so, mine would be messed up by now, because my mother, we would use that growing up,
What will wear the teeth is this, and this is gonna be my public service announcement, which is,
yay, here we go.
And if you own a toothbrush that says hard bristle or medium bristle, I want you to throw those away immediately. And those are the things that will actually damage the teeth. They wear the enamel of the teeth. And remember at the beginning, all I said when you clean your teeth is that you're removing plaque. And plaque is soft. You can even actually remove it with your finger. So all anyone should ever be brushing with is a toothbrush that's either has soft or extra soft bristles.
Oh my gosh.
That preserves the tissue of your gum tissue. It preserves the enamel. And
I've tried to use a soft one. The soft one feels like it just does not take what needs to be off of there. But now I use, of course, I've been using this for years, but I have to use a regular brush to brush my tongue.
Yes.
But I use my electric one, the circle one, for my teeth. And mine is medium. And it's not good.
Yeah, you'll switch and you'll find that how your teeth come out are still going to be the same. And even with that soft or extra soft bristle toothbrush. Most spin brushes And now usually come with these soft bristles, and they have like a safety feature so that you can't bear down on it, so that way you won't actually damage the teeth or brush too hard.
I've been using that one for years, but I change it, put it.
Yes.
So can I use the hard toothbrush for my tongue? Because I be wanting that stuff off, and I even have a tongue thing that pulls it,
Yes. The most important thing that you could do when you actually brushing your teeth as well, and we didn't get into that, is brush your tongue as well.
Yes.
Because a lot of bacteria collects on the tongue. The tongue is like a shaggy carpet. Okay. And any and everything that we're eating all day long and everything falls into there, and your tongue has all these little grooves in it.
Yes.
And it falls there.
Yes.
Well, that material, whatever is not washed away with any type of liquid that you might be drinking, sits right there.
And that's what gives you bad breath too,
yes.
along with the gum disease.
Yeah, you get gum disease with it. So a lot of times, when you're actually brushing your teeth, you brush your tongue. Further back you can get on the tongue, the better.
The better.
Because that's where the majority of any type of bacteria that's going to collect is going to be there.
Oh, wow.
And, so I know a lot of times when patients first start cleaning their tongue, I tell them to get back as far as that. They say, "Oh, well, doctor's going to make me gag." It will at the beginning. And but you'll wind up getting in the habit.
Yeah, I do. I go way back. Yeah.
Yeah, and then that helps out with it.
Because I'm not gonna call no names, but some people I'll have to say, "Oh my gosh, did you brush your teeth today?" "Yes, I did." "Okay, well, go brush your tongue because it's still something going on."
Right.
And I'm smelling something in it. I should not be able to smell anything. And then they're thinking, "Oh, okay, I didn't brush." Oh, that has something that goes. It's the whole kit and caboodle: teeth, tongue, all of it. Brush it all. That's what I tell them. Yes. Okay, a child that's under 4 years old, can they use adult toothpaste?
The adult toothpaste won't necessarily affect your child as far as using that, but more importantly, it's more so the taste. What you're trying to do and what we're trying to do is get that child to want to brush their teeth. So that's the purpose of when you see kid toothpaste. The kid toothpaste works the same as an adult toothpaste, but it tastes better.
I needed you to say that. So I hope that my adult children's with kids, my grandkid, this is what my granddaughter, this is what was asked to me the other day, and I couldn't wait till you get here so I could ask you. Because it was like, well, I got to go and get some toothpaste. Because my daughter's out of toothpaste. I said, just let her use what we have. And he said, no, you can't use no adult toothpaste. She's only 3. And I said, way back in the day, my mother didn't buy no daggone adult and children and all of this. Just use the stuff. And he was like, no, I'll wait out. No. And I said, it's not going to hurt. And I was talking like I knew, and I didn't know for certain, but I do know what I did when I was growing up.
Exactly.
But I'm glad it did. I said the right thing.
Yes, and that's really the thing.
The taste.
It's just the taste, because you notice that those children toothpaste, they may have bubblegum flavor,
and I
cherry
said that.
flavor.
And I said that.
And that's to stimulate a habit for the child to want to brush their teeth.
Yes.
Yes.
And I said that, and I said that to him. I said, look, it's the same toothpaste. I think they just put it in there just so it can taste good. And I was still like I was guessing because I would needed him to go ahead.
Well, you guessed correct.
I guess. Okay. So can you continue to eat sweets as long as you want, as long as you brush your teeth?
Yes and no. And I'm never going to be an advocate to say, hey, you can't eat any sweets if you want to keep your teeth. No. But like with anything, it's got to have moderation. Yes. Because getting back to what we was talking about before, the higher the sugar content makes you more susceptible to tooth decay.
Of course.
But not only that, makes you throws off other things and systemically as well, as far as if you had diabetes. So those are the things that you want to try to kind of moderate, with that, to make sure that you keep that down. You want to at all times lower that bacteria count in your mouth, and you don't want to feed those bacteria that are there, and with constantly giving them sugar all day long.
Right.
And which is why we always advocate against, people who may suck peppermints all day long, or people who drink in soda drinks all day long. And because the sugar content and of bathing the teeth like that all day long like that will feed those bad bacteria to whereas it speeds up the process of them doing that bacteria doing something detrimental to your teeth.
Okay, churchgoers, because I know even growing up in the church, the old women would always have peppermint and give you some all the time.
Yes.
So you got to think about that when you're popping those peppermints and you're sitting there listening to the word. You don't want to pop too many, right?
Yes.
Okay. All right. Now this I heard. I think I saw this on a movie or something. Is it true that if you were, and I'm just using this as an example, guys. If you like you said the story when you broke your teeth, you're out. Can you put it in milk and take it to the dentist and they can put it back in?
Okay, the answer to that is yes.
Okay.
All right. So with kids, whenever a tooth is knocked out, and let's say, for instance, this is usually some type of trauma that has happened. Let's say, for instance, we have kids that may have been on the playground or something like that and accidentally knock a tooth completely out.
Yes.
If that tooth is completely intact, then you want to put that tooth either in milk first or water second. And we say milk first because milk has certain proteins like calcium and D, which is for teeth.
Yes.
Okay.
Yes.
So as you transport that immediately to the dental office, a lot of times we would take that tooth and re-implant it in that child's mouth.
How does it catch on? It has it's the roots come out, right?
Well, what we wind up doing is that tooth is placed back in the mouth, and then they will do like braces to stabilize it, to hold it in place until the fibers can reattach to that tooth again.
Sort of like if you were to have stitches and they stitch it up and it'll automatically just reconnect?
Yes. And so
I love this.
Yeah, so with that being said, it has to happen within a certain window of time.
What is the window of time?
And that window of time is that you need to get to a dental office within like a 2-hour period.
Gotcha.
Yeah. And because the quicker you can get to a dental office, the higher the success that it will work.
Right.
When we reimplant that tooth.
I love it. Okay, what makes a person grind their teeth while sleeping?
Most people are actually unaware that they actually grind their teeth. And
hold that thought because I'm gonna forget. You remember when you looked in my mouth and you said, "You grind?" And I'm thinking, how did this man know that I grind my teeth? Oh, are they? I was wondering, were they? How do you say? Down or like a fingernail file, or what did you see to know that I grind my teeth?
Yes, for everyone, every dentist will always automatically know if a patient grinds their teeth just by looking at them. When you open your mouth, because when anyone grinds, your teeth are moving in like an elliptical motion, like a circle. And so what happens over time, as your teeth are grinding in a circle when you're sleeping, it leaves little circle marks on the teeth, which we call a wear facet. So there's only one way you can get a wear facet, it's just grinding your teeth. God. Other than that, you never get that.
Oh my gosh.
Or the second way is like if a patient has been a heavy grinder over years, if I'm seeing them for the first time, I can look on their x-rays and their teeth are all flat. There's no humps or ridges on the teeth.
So you can grind them down that low to...
Yes. Actually, without any treatment, you actually grind completely through the enamel. And what that eventually winds up doing, some people may have said, will say, wow, sometimes it hurts when I open and close my mouth. And that's your TMJ. And that's the joint that actually opens and closes the mouth. Well, that comes into play with patients who grind their teeth because chronically over time, that puts too much stress on that joint. Because it never gets a chance to actually rest. Because of the fact that you're constantly are at work. The maximum amount of pressure on the muscles of the face is when we're eating. Okay. And grinding simulates eating forces.
So when you're grinding at night, it's like you eating all night long.
Yes.
So when you wear the protector thing that you told me to wear,
Yeah,
I wear the
guard.
guard. that will help you not grind down the teeth.
Right. Because what happens is that during the night, the grinding habit, there's no way for you to control it because
Okay.
you're sleeping. Okay? And what winds up happening is we make you an occlusal guard such that when you now go to try to bite down and grind, now those forces are exerted onto that splint and not the teeth. So the teeth are protected
Yes,
now.
yes.
And but because you have that guard in there, now it stimulates the brain to know, okay, the teeth aren't together. I can't get them together. So it reduces the grinding, the
Oh.
force of it, which in turn takes the force off the joint as well.
Okay.
And so that's how the splint therapy actually helps the patient when we put them in there.
Okay.
And as far as reasons why patients grind, a lot of times it's due to basically stress. It could be a job. Some people grind their teeth in traffic. And we all know about traffic here in Atlanta.
Road rage!
Exactly. And so it's things of that nature, because what we all should always know is this. The teeth should never come together other than when you're eating. Other than that, the teeth should always have a tiny, when you're not speaking, there should be a tiny space in between the teeth. And because the thing is, grinding as well as clenching, because some people just keep their teeth together.
Okay.
And that's also that happens sometimes when you might be at a computer screen doing work.
Right.
And we got our teeth together. Now, that's a no-no.
Or when you get mad, you're like, that's me.
That's right. Yeah, have to have the space in between those teeth, and that takes that pressure off.
Oh my gosh. Okay, which one is more important? I know both of them are, but flossing or brushing, which one is more important?
Actually, they both are.
I knew you were going to say that. I knew you were going to say that. But yeah, because
Here's the thing with everyone. Flossing gets in between the teeth, to keep them clean, to get rid of that plaque. All right. The toothbrush bristles on any type of brush that you're using, whether it be manual or whether it be motorized, those bristles are too thick to get in between the teeth. So you could have perfectly good teeth and say, hey, I brush every day, but if you don't floss, what's going to happen is that when you come into the office, you have cavities, but they're all in between your teeth. Nowhere else but in between the teeth. So that's the reason why flossing is as important as actually brushing the teeth as well. So that way it allows you to get to touch all of the surfaces of the teeth, and including those that toothbrush bristles can't reach. Yep.
All right. Well, both of them are important. And I was thinking, when I put this down here, I said, let me see, which one is important? I already know both of them are. They both need it. But which one is more important? And I knew he was going to say both. There's no such thing as that one is more important than that one. It goes together like...
peanut butter and jelly.
There you go. All right. Exactly. Okay, we're done with the questions, Dr. Tillon. I have a couple of myths that I did not know about. I really didn't know. But some of them I did. This last one that I'm going to go over is like this. I don't believe that a lot of people knew this one as well. But when I say it, I will. Okay, brushing harder cleans the teeth better. You said no. You've already went over that. That's a myth. It does not.
Right.
Sugar is a sole cause of cavity. It's not.
No.
Not just sugar.
No.
Okay. Everything, a lot of stuff like saliva and not cavity, but
a lot of things will break down into sugars and sugar components, and so it's not necessarily just eating like candy, and most people will equate that to that, but a lot of foods that we eat break down into sugars, like white bread.
Yes.
Any type of starches.
That's right. Rice.
Yes.
Potatoes.
Yes.
That white stuff.
Yes.
Everything that's white is usually it's starchy. It'll turn into. It's bad for diabetic patients.
Basically.
Yes. Okay. White teeth are always healthy.
No.
Not at all. That's a myth. That's a myth, guys.
White teeth always look nice.
Yeah. That's it.
But that's
Exactly. Okay. Baby teeth don't matter. That's a myth, right?
No, that's a myth. And let me tell you why.
Okay.
All right, for parents out there, when they're looking at the baby teeth are important because they serve as a guide for the permanent teeth to come in. Okay. When those teeth are missing, now there's no roadmap for the permanent tooth underneath to know exactly what position to come in.
And you're speaking of if they are missing too soon,
Yes.
right? Because they're gonna fall out. Because
Right.
I have a daycare, and my children, when they go to kindergarten and they come back, I think around age 6, those two front tooth fall out and all those. That's the normal way. But if
Yes.
they came out not the normal way, that means you done messed up the pathway, right?
Yes, you messed up the pathway
Okay.
because the reason why those permanent teeth tend to come in the position that they are and that the baby teeth fall out, because as the permanent tooth is growing, it's eroding the baby tooth to make it loose. So that's that pathway.
Yes.
And for it to erupt into the mouth in the right position. And also those teeth are very important. And so as well as we like to take care of our teeth
Right.
as adults, and it is important for us to take care of the child's teeth
Yes.
as well, because
Brush their teeth.
It's
Parents.
just very important.
Yes. Okay. Bleeding gums are normal.
No.
No, a myth. All of these are myth.
And bleeding gums always is an indication that something is going on wrong.
Right. And I don't even know. I got it from Google, but I don't even know why anyone would think a bleeding anything. Blood's
Right.
not supposed to be on the outside of your body. So if you're able to see it, something is not right.
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 Exactly.
Okay. Kids don't need to brush the baby teeth. We just talked about that.
Right.
Yes, they do.
Yes, they do.
Everybody needs to brush their teeth. Okay. Enamel loss causes sensitivity.
Yes.
Okay.
The thinner the enamel on your teeth, the more sensitive they're going to be, because the enamel on your teeth not only serves as protection for your tooth, but it also insulates the tooth as well. So as we wear the teeth, getting back to the people who grind, and when patients grind, as thin as their enamel starts to get over time, they always start suffering with sensitivity, and because of that, and when they wear down their enamel. So yes, the enamel is very, very important.
Okay. Gum disease is the only concern for your mouth.
No,
We know that's a myth because you just went over a whole bunch of things that, yeah. Okay, so this is my last one. You should, now, when I read this, guys, this one here, I know you guys are going to say, okay, my mother always told me to brush after I eat. If you eat something you want to brush, your teeth, it's always a good thing, but no, it isn't. Let me just read. Okay, you should brush your teeth after eating. And it says no. I didn't know that. And I don't think, I can't think for everybody else. I just didn't know it. And I hate to say what I don't know, but I just really didn't know that. I thought it was always good. If you eating something, if you want to brush afterwards, it's a good thing because you're getting all the stuff off, but it's not necessarily so. Let me read this. It is generally not recommended to brush your teeth immediately after eating. Here's why. Acidic foods and drinks. Consuming acidic foods or drinks such as citric fruits, sodas, and coffee can temporarily soften the enamel of the teeth. Brushing right after eating can further wear down the enamel, increasing the risk of cavities. Y'all don't know what? You're out there brushing your teeth after you eat, and you're and I know I might be saying this wrong. You're making it. You're not. That's not helping you. It's making it bad for you. I didn't know it. You probably didn't know it. But now you know. Don't brush right afterwards because whatever you're eating, it could have been a lemon or orange or had a margarita or whatever. And you're like, let me get that tartar taste out of my mouth. And you start brushing. That citric stuff that's already on your enamel is doing his work. And you don't need to go behind it and take it more off, right? Am I saying it right?
Yeah, because most importantly, you got to let the body do its thing.
Do his thing.
And because look, the good Lord has done majority of a miraculous thing with the mouth.
Yes.
And all of us in general. And we have enzymes that are in our mouth that counteract the acidity to raise that acidity level, but you got to give it a chance to do that.
Yes.
And that is the reason why you don't want to necessarily immediately do it, because your body is going to help to do that. That's part of the why you have saliva flow in the mouth.
Okay.
And inside of that saliva is that those enzymes that I'm talking about. So remember we talked about good bacteria.
Right.
Allow them to do their thing, and to actually protect the teeth. Because there's a natural coating that's on everyone's teeth. Like I said, that's called a pellicle. But the body produces that pellicle. So the thing is, do you want to brush your teeth like later? Yeah, that's fine. But immediately afterwards?
Yes.
No.
Yes. And that's what later is good. But when I read it said no, I said, oh my gosh, I've been doing it wrong all of these years. I never, and you would never know to ask your doctor, that, because you just think that that's just something we should do anyway.
Right.
Okay, Dr. Tiller, I am just so excited about you being here. Is it something you want to show with these here?
Well, the only thing I want to let someone know is that a lot of times, for whatever reason, people lose teeth. And sometimes it could be due to tooth decay, gum disease, or sometimes to trauma, things that aren't their fault.
Okay.
But now there's a second lease on life as far as with replacing a tooth, and that's what's known as an implant. And basically with an implant, it allows you the tooth that was lost, we can now place an artificial root in its place, and then attach a tooth to that implant. And basically now it just looks just like a natural tooth, and no one even knows that you even have a tooth that's ever was missing.
And so even so I know that the I'm calling that a screw. I don't know the right terminology,
Yeah.
but you would make that tooth up there,
To attach to
even if they
that
didn't have a
implant.
tooth at all.
That's right.
So nobody has to
Right.
walk around with spaces.
Right.
Especially in the back. I know a lot of, I'm not trying to be funny, ladies. I'm just saying, I just know back in the day when I see some older women, I'm going to say seasoned, because I don't even like the word older, seasoned women chewing gum, and they're chewing with these teeth up here because they ain't got no back teeth.
Yes,
And they're like,
exactly.
I'm like, God darn, just pick the gum out if you got to look like that.
Right.
But now you can do that and they can have those back. Is that expensive? Or?
And it tends to be, well, I should say this. It's all relative in the fact that it allows you to replace that tooth, and it's hard to sometimes put a price on quality of life. With it. On average, though, with a single tooth implant, you're talking about start to finish, use like about $3,500 to $4,000.
Okay.
And but to the patient that's missing that tooth and now has a permanent tooth back again,
it's worth it.
It's priceless.
Priceless.
And then the last thing to kind of piggyback off that, we all have patients, grandmothers and grandfathers, and even sometimes parents, regular parents, and that may have lost all their teeth. And a lot of times, patients will have dentures and everything like that, but it's very difficult to eat with a denture. All of us probably know or have a relative that has a set of dentures, and when it's time for them to eat, they take the dentures out.
Yes,
And to go to eat, because it's incredibly difficult to eat with a denture because it's just sitting in there. Well, what we do now is the same thing. We actually have like implants that are placed, and what we make now is what's known as a snap-in denture.
Turn it down.
And it's not we have the denture, has these little rings on it, just like your grandpa or grandmother used to have, and except that it has these little rings. We attach it to the implants, and that snaps right in.
Let me see. Oh my gosh.
And then that way the patient now can eat any and everything that they want.
And this won't pop out at all.
It's impossible for it to pop out.
Are they able to take it out themselves if they want to?
Yes.
Oh, wow. Yeah, they needed this back in the day because me growing up, I saw a lot of them. Just it's like,
Right.
ooh,
Yes.
okay.
Yes. And that was just a common procedure. And then a lot of times, there was nothing else we could do with patients other than to give them denture adhesive.
Yes.
And to hold it in.
The
glue.
And it did do very well.
Right. Right. And the other thing is that it doesn't taste good.
You can taste it underneath?
Yes. And so that denture, he said, does not taste good. And most denture wearers will tell you that. And so now I do more dentures like these than I do of the old traditional type. And this actually gives my patients such a new lease on life. And a lot of patients of mine who actually, after they had that done, say, I should have done it sooner.
Oh, I could imagine. Yes. Dr. Tiller, I appreciate it. I'm excited. I'm so glad that you came. Thank you for being on my show. Guys, if you do not have a dentist office, everything about Dr. Tiller, all his information will be at the end of this or at the bottom here. Just look and you can see, where to contact him, all of his information, and look him up. I am vouching firsthand for this is, how do they say, the GOAT, thebomb.com. I love him and he does such a good job on my teeth and he's a good dentist.
Thank you very much.
You're so welcome.
I'm glad you had me come.
Oh, yes. Okay, guys, like always, feel the rumble and listen to the roar, and we'll be back next time. Bye-bye.
Bye, guys.